Good evening, everyone. My name is Bunty Chand, and I work for the Asia Society India Center. Asia Society's programs across our 14 centers are now virtual and global. We have hosted more than 600 programs during this lockdown, not just at the India Center, but globally, including some meaningful discussions on food security, public health, and world politics. They are all available on our YouTube pages, so please do go ahead and view these webinars when you have the time. Our discussion today on India's road to urban resilience will look at how Indian cities can strengthen their response to increasing public health and climate change risks. This is the third program in our series on building cities of the future, architecture, urbanization, and public health, where we have previously discussed issues of housing, urban planning, public transportation, and mobility through the lens of public health and sustainability. Indian cities have tackled serious public health and infrastructure challenges this year. Urban centers account for a large number of COVID-19 cases, but have also faced cyclones, floods, and heat waves in varying degrees. While the pandemic has highlighted the need to build efficient health and sanitation systems, the effects of climate change have uncovered the existing gaps in the present infrastructure that could further weaken the collective response to future outbreaks if left unchecked. Today's webinar will discuss how cities can upgrade their risk management systems by adopting a multifaceted approach to urban resilience with the help of architects, urban planners, climate researchers, and public health experts. We have a wonderful multidisciplinary panel with us today. Please allow me to introduce our speakers. Amit Prothi is Managing Director of Asia Pacific at the Global Resilient Cities Network that collaborates with nearly 100 global cities to protect vulnerable communities from climate change and other physical, social, and economic challenges. Recently, as part of the program, he was responsible for managing the preparation of resilience strategies across several Asian cities, including Seoul and Chennai. Dr. Shifalika Goenka is a professor at the Public Health Foundation of India. She also leads the Physical Activity Program at the Center for Chronic Disease Control. She works in the area of physical activity, built environment and policies, worksite health promotion for the prevention of non-communicable diseases and obesity, and also bioethics and qualitative research methods. Amir Bazaz is Senior Lead Practice at the Indian Institute of Human Settlements. He has worked extensively with various integrated assessment frameworks and modeling arrangements. His current research interests are low carbon societies and infrastructure, climate change mitigation, and adaptation with a specific focus on urban climate change linkages and climate, energy, and environment policy. Aditya Bahadur is the principal researcher in human settlements at the Indian International Institute for Environment and Development. He's a specialist in climate resilient urban development, transformative approaches for risk reduction, monitoring and evaluation of resilience initiatives, amongst other areas. His current work explores the interplay of climate change and disaster risks with urban development in the South and Southeast Asian region. And I've just heard he's also writing a book. And just a bit of housekeeping before we proceed. All those who are joining us in Zoom, please leave your questions in the Q&A box and not the chat box. For our audience on Facebook, please drop them in the comments section. And now I'm going to invite Aditya to start the discussion. Thank you.
Thank you very much, Bunty, for that kind introduction. My name is Aditya Bahadur, and I'm a principal researcher at the International Institute for Environment and Development, which is an independent charitable research institute based in London. And we work on environmental policy issues at the global, regional, and national levels across the world. I'm really privileged and delighted to be invited by the Asia Society India Center to host this webcast today with such an eminent panel. I am, however, going to abuse the privileges that I've been given as a moderator and frame this discussion in about 5 or 6 minutes now before we pivot towards a talk show style discussion with our three panelists that you are probably more interested in hearing. I think the topic of today's conversation is urgent and important for a number of reasons. For the first time in the history of the world, more people live in towns and cities than in villages. 55% of the world's population is now urban, and we now have 4 billion people living in towns and cities across the world. This number is going to rise to 70% over the next 3 decades or so. North America is the world's most urban region. Africa is the world's least urban region. But Africa is the world's fastest urbanizing region, growing at almost 4% per annum. South Asia comes second at 2.5% urban growth every year. So more and more people are living in cities. At the same time, the world's towns and cities are also receptacles of risk from climate change and disasters. And cities and towns concentrate this risk. Risk is a sum of 3 things. A, we have hazards, be it sea level rise, cyclones, floods, drought. We have exposure, which is how many people live in the path of a hurricane, how many people are going to be affected by a flood when it hits a city. And third, we have vulnerability, which is the innate susceptibility of people to be impacted by these shocks and stresses, and as a function of safety nets, social capitals, savings, etc. On all these 3 counts, cities are in the eye of the storm. Within our lifetime, big cities across the world will face between 1.5 degree to 2.5 degree temperature rise. If that doesn't sound like much, just picture what happens to the human body when the temperature goes up by 2.5 degrees. Also, currently, something like 150 million people across the world don't get the basic minimum amount of water that they need, around 100 liters. By 2050, this number is going to go up to 1 billion. At the same time, people are highly exposed to shocks and stresses. 65% of the world's cities lie along coasts and rivers, locations that face storms, sea level rise, floods, and a whole host of other disasters. 14 million Indians live in low elevation coastal zones 5 meters below mean sea level and are highly susceptible to many of the same shocks and stresses. Vulnerability is extremely high in cities. This is the innate capacity of people to deal with different kinds of disasters. And almost 1 billion people across the world live in informal settlements and have poor basic services, lack of savings, and suffer from a whole host of other problems that erodes their ability to battle different kinds of shocks and stresses. A key part of people's vulnerability is increasing public health crises. Across the cities, we've seen a spike in cardiovascular diseases, in mental health problems, in diseases such as diabetes. And of course, this is even before a pandemic such as COVID-19 hits the world, where almost 90% of all mortality and morbidity across the world from COVID-19 has been in urban areas. This is the reason why the discussion on building the resilience of towns and cities has become more and more important. The word resilience traces back to the Latin word resiliere, which simply means to bounce back from a particular shock or stress. And urban resilience means the ability of a city to function and flourish despite shocks and stresses. Of course, writing on resilience goes back decades, but really urban resilience came to the fore towards the end of the 90s, where a lot was written about urban resilience in the context of security issues and terrorism threats. Over the next 10 years or so, the definition of urban resilience got expanded to talking about a range of other shocks and stresses. And 10 years on from there, resilience has become a governance paradigm where the way in which cities are governed needs to be alive to the risks that a city faces. Now, most recently, research at our institute is calling for disrupting existing ways of building resilience, given the new kinds of shocks, stresses, and risks that cities face, where stresses like COVID-19 interact with hydrometeorological and biophysical shocks and stresses. So this is very much the context which this conversation is taking place. And I'm delighted we have 3 such eminent and informed panelists with us. Starting with Amit. Amit, you've led one of the world's largest urban resilience initiatives. Tell us in a few simple words, taking a minute or two, What exactly is urban resilience in your own words?
Sure. First of all, thank you for having me. I think it's an incredibly important topic, as you've just highlighted. And we're sitting in the middle of a pandemic, right? So all of us are actually experiencing a disaster globally and thinking about how do we bounce back from that? How do we recover from that? And the fundamental of resilience really, as you mentioned, is bouncing back. How do we come back? Now, I work for an organization called Global Resilient Cities Network. It's a city-led network which has around 100 cities globally that are participating in this. It was sponsored by the Rockefeller Foundation about, over a series of different initiatives. The idea is, how do we work with cities to help them think better as to how do they actually bounce back if they face any disaster? And the reason we focus on urban resilience and not one particular disaster is that you don't know what stresses and what shocks a city system might experience. Today, we are talking about, a pandemic, but that doesn't mean that we may not have a flood. And that doesn't mean we may not have heat instances, and that doesn't mean that we may not have drought situations. So cities experience a variety of different shocks. And the idea of resilience really is that you can't address each individual shock and be prepared for each individual shock. But if you can strengthen your system, then you're able to withstand a variety of shocks. So that's really where the intention of resilience comes from.
Perfect.
I'll stop there, and then I'll come back and give.
I'll come back to you as well. We need to know more about the network that you're working with.
Yep.
Amir, you're one of India's leading climate change researchers. Tell us what we mean by when we use the term urban resilience or even urban sustainability.
Yes, so thank you very much. First, Bunty ji and the Asia Society Center for inviting me for this discussion. It's a very important discussion, and we need to be exchanging views to think about how we can build resilient cities in particular, and particularly in the context of India. Well, I'm honestly not very concerned about the definitional dimensions of these things. That's, in my view, like a matter of semantics. I feel that there has to be a conceptual lens or a conceptual or kind of an analytical lens that should kind of guide us to understand what resilience means. And for me, that conceptual lens in the context of cities is vulnerability. Vulnerability at multiple scales, at the household level, at the community level, at the neighborhood level, at city scale. And I think this kind of a definitional or an analytical reference allows us a lot of lateral mobility to engage with a lot of systems. It allows us to kind of bring the idea, in some ways, bring people into the center of the debate, and also allows us to link with aspects of livelihood. I think that's what cities are about, and that's the main contribution of cities. So I'll stop here.
Okay, thank you. No, that's very clear. Thank you. Come back to you for a more in-depth discussion in a minute. Shifalika, you're a noted urban health expert. Paint us a picture of what a healthy and resilient city looks like.
Okay. So thank you for inviting me. It's a delight and a privilege to be here among such esteemed panelists. And if you have a city plan or design, land use policies and built environments which are health promoting, the same policies and interventions actually are also environment protective. For example, let's look at some of them. According to the best science available, every individual should have a green space, a green park, within 0.4 kilometer radius from wherever he is. That's one of the very critical requirements because it increases physical activity levels. Plus, there are not a lot of unknown effects which we have not been able to find, probably air pollution and others, which have wide-ranging benefits in lowering diabetes, hypertension, mental illnesses, prostate cancer, refraction. Every child nowadays is getting spectacles, spectacles in children, cognitive development in children, or overall mortality, and a whole host of other diseases. So that's one aspect. The second aspect, of course, there are multiple. I'm just going to give you some of the key aspects. The other is making physical activity or active transport as the most preferred option, most desirable option, most convenient option. And that comes from multiple ways. That's the way you need to think. Making your pavements as wide as the road. The width of the pavements on each side should be as wide as the roads. The motor carriageways, within cities, you can't have motor carriageways more than 2 lanes wide. And lush green tree canopies on both sides, which will help lower surface temperatures by 20 to 25 degrees Celsius in high heat conditions, ambient temperature by 4 to 5 degrees, and significantly lower the air pollution. These are just two interventions.
So city that is lush green and where people are able to be active. Now, you worked in the urban context. You know that cities are beset with all kinds of problems, from law and order problems to economic problems to social problems. Imagine that I am a decision maker in the finance ministry of a developing country, and you find yourself in an elevator with me, and you have a minute to convince me as to why we should be investing precious and scarce resources in enhancing the health and resilience of cities. What would you say?
Okay, so coming back to what I just said, widen the pavements, put the trees, so that will decrease your levels of diabetes, cardiovascular disease, cholesterol, a whole host of all chronic disease, as well as prevent transmission of the COVID virus. So that's one thing. Plus, we are somewhere mitigating. Remember one thing, COVID virus is just one of the viruses. There are more than 1,000 viruses out there which are in the process of evolution, which any time they're going to make that human jump. Ebola, we were lucky because it was kind of constrained to Africa. So we need to look forward, not only this virus, but many more to come.
Got it. Got it. Okay. The elevator has reached its destination.
Okay.
Amir, what if you found yourself in an elevator with a decision maker? Convince her or him to invest in resilience in a span of 10 or 12 floors.
Well, my only argument is that you will, by doing so, you will be actually underwriting or basically mitigating or offsetting a lot of social costs. So you'll save a lot of money, and that's my simple pitch.
Tell us what you mean. What do you mean by social cost, and what will we save?
Look, I think what we need to understand that if we are, so the choices that we make, both on the policy side or the kind of infrastructure we create, those lead to certain kinds of externalities. So there's someone who's bearing the cost, and it gets transmitted in a certain form in society. Say pollution is a big example. Now, as policymakers, we need to understand that are we ready to pay this cost? Are we ready to bear this burden, which will be undermining a lot of potential that our people have and our systems have?
Right. Great. That was a very long elevator ride. We'll imagine we were in the Burj Khalifa. But Amit, over to you. Your elevator pitch on why investment in urban resilience is critical.
Sure. So I'll take the infrastructure perspective. I think there are numbers out there that cities lose a quarter of their GDP to disasters. So if there's a flood, people can't travel to work. If there's a flood, infrastructure gets damaged, assets gets damaged. That relates to good decision making. So if you invest in good decision making, and there's a variety of things you can do in that space, you're essentially saving quarter of your GDP that you're losing to disasters. That's my pitch.
Great, that's really clear, and is a good segue to my next question to you, which is that you went to the prestigious School of Planning and Architecture and then on to MIT. You're an urban planner by profession, by training, what is urban planning and what bearing can it have on a city's resilience?
Sure. So I think all of us in the city space think about transportation, think about land, think about zoning. We've heard these words. We've heard master planning. Effectively, it's allocation of land uses at the most basic level. It's allocation of land uses across a city. That's where it starts. Now, then you start to build it up. You start to understand, how should a city function? How are the various systems that are supporting a city and supporting its people? How should they be set up? That's the basis of urban planning. And it starts getting more and more sophisticated. At the most basic level, it's allocation of land, allocation of infrastructure, understanding of population what are your population projections? If you're a city like Detroit that's losing half your population, what do you do? If you're a city like Mumbai that's growing exponentially, what do you do? How do you actually plan for that growth? Plan for jobs for people, plan for protecting the environment, plan for the healthy city that we're talking about. How do you make those particular decisions? And often these are government decisions. These are actually assigned in state legislation. So it's actually, depending on where you are, but in the Indian context, it's the state government that gives the power to government to actually plan. But essentially, as a planner, you're helping this government make those decisions. And I'll stop there.
Great. I think that's really clear. Amir, you work for the Indian Institute of Human Settlements that is renowned globally for its cutting-edge research on the impacts of climate change in cities. Paint us a picture about what happens if our cities don't rise to the challenge and start to take urban resilience more seriously.
Well, it's a pretty straightforward story. Our economy is like hugely, immensely concentrated. And 60, 70% now maybe of our GDP is being produced from cities. And we have a lot of other challenges. We are just 30% urbanized right now. And it'll kind of hit 50% by 2050. 50% will be living in areas where land-based livelihoods will dominate, which are already stretched. And cities need to produce a certain level of wealth and income that allows for redistribution and address development challenges, build universities, colleges, schools, etc., provide effective healthcare for people who need them. And I think it's a very, very smart kind of a strategy, I would say. We need to do this because that's essential to do. You can't be avoiding it, and because there's a lot at stake, and you won't be able to address a lot of development challenges that we have if we don't have resources. And cities are very crucial elements in that story. And therefore, apart from making cities vibrant enough and kind of a certain kind that has sufficient absorption capacity, is able to generate sufficient livelihoods, is able to provide all kind of basic services, it also is generating a lot of resources. And I think that's a very simple argument that I would build on and say that, look, that's the need, and that's the imperative.
But Amir, are we making castles in the air and talking about the hypothetical? Or are there examples from cities that you worked in and been to that you can point to and say, this is an example of how you can start to build resilience, or an illustration of what a resilient practice looks like? Give us a couple of illustrations of what you mean when you say a city needs to become more resilient.
Well, I wouldn't say that. Of course, Amit is the right person here to give, because as researchers, our job is to do research and to produce evidence that is probably useful in the context of of, of decision makers making decisions. I think in the context of what I do in terms of resilience, etc., I would only say at this point that cities in India, because I work many Indian cities, are increasingly worried about what may happen to them if a disaster strikes, etc. So there is a very distinct inclination towards engaging with different kinds of stakeholders to basically understand this. And I think at this stage, I would only say that apart from whatever programs and missions, etc., are happening, there is a renewed focus on utilizing and making use of the present opportunity to kind of make a massive, gigantic transition towards something very, very significant, which sustains itself for a longer term. Yeah. And I think the interesting thing there is that there is a recognition and a willingness towards engaging with evidence. Right. And themselves, city governments are trying to collect evidence, but also being very open to evidence that is being presented to them.
Right, right. Great. Before I go to Shifalika, Amit, I'll come back to you. You worked in 100 resilient cities. I'm going to ask you to talk about that in a bit more detail in a minute. But before we proceed, point out a few resilient practices that you've seen in your long career working on this issue. Tell us about some of the cities that you feel are resilient and paint a picture of why you think they are really resilient.
Sure. I think, so I won't say that, resilient, there is not a state of resilient city. You're actually always moving towards resilience. So it's a goal that you're trying to achieve, right? I'll give you an example. Now we've had COVID, and the city of Quito in Ecuador, we did a resilience strategy with them over a couple of years period. One of the issues they highlighted was important to them that they wanted to address was food security. They recognized that the way their system was, they needed to pay more attention to the particular topic of food security. So they went about creating urban farms. They went about creating food labs. This was the intention. This was nothing to do with the pandemic, right? This was just a recognition that food systems needed to be strengthened. And then the pandemic hit. And when the pandemic hit, the city was ready to feed 100,000 people, right? They could immediately mobilize the food banks. They could immediately mobilize the urban farms that they had been setting up. So that's an example of a resilient system. Now, they weren't planning for the pandemic. They were just planning for vulnerability around the food security system. Now, similarly, if you imagine, we think about our health systems, and in the process of understanding the resilience of a city, we identify that the health system needs to be strengthened regardless of the pandemic. And we work towards it. And then let's say there's a pandemic or there's an emergency, you have a system that's resilient and can actually serve and reduce the impact of the disaster. It's about reducing the impact of the disaster. And the link is, the way we've done strategies now across about 100 cities. And the way these strategies are really laid out are, you try to understand the underlying stresses in the system. And the idea is that those stresses, if not addressed, can actually exacerbate when there's a disaster, right? So that is the link. And so, the food security is an example. I'll give you another example from Buenos Aires. Buenos Aires had been already investing in technology in schools, variety of different, getting teachers trained around the use of technology, having kids with access to devices, etc. Now, again, when the pandemic hit and most kids had to go and do remote learning, they were better prepared, right? They didn't suffer as much. So those are just some examples, and there's a lot more, we can come back to
that's really clear, yeah. Shifalika, you've heard Amir and Amit talk about urban planning, urban governance. Tell us a little bit about how urban planning and design impacts the health of urban populations. And tell us a little bit about the work that you've done as one of the country's foremost urban health experts.
Thank you very much. So urban planning, land use policies, it's an excellent question. And I'm so glad because very rarely do you find podiums in the broader urban planning space where you all are thinking of health. So I'm completely really excited about it. So urban planning and land use policies, built environment has a profound impact on the prevalence or the levels of blood sugar, blood pressure, cholesterol levels, osteoporosis, tuberculosis, lung cancers, prostate cancers, breast cancers, rheumatic heart disease, so even infectious diseases, and depression, cognitive development in children, and a whole host of other diseases. So that's extremely, it's there, the science is there. And the power in the hands of urban planners is immense, and it's not looked at. So it's not being realized, which is, I really feel sad about it, and I hope we're able to make that turn. Thank you.
Right. So could you provide some solutions that would help tackle the conjoined environmental and health crisis that our cities face beyond issues of increasing green cover and active mobility that you talked about in your introductory remarks? Let's get into a bit more detail. Take 3 or 4 minutes and give us your thesis on what is the solution to this pernicious problem.
Okay, it's not one solution or one thing, but you have to look at it more as a comprehensive issue. For example, the way you design your buildings, they need to have enough natural light coming in. We are seeing that the bone density levels overall in the population is going down because people are working long hours indoors without having exposure to sunlight. The entire thing of high density constructions where you have in one building people working in environments, whether it be hospital situations or education institutes, when you walk from one building to that, so everything's coming down to physical activity in daily living. It's not about gymming and listening to an iPod. It's about being active in your daily life in the natural environment. So that's one aspect. Plus, talking of slums, I saw some things coming up on the chat on slums. We are having very high levels of migration because the farmers are on rain-fed agricultural livelihoods and sustenance. So due to failure of crops, unable to make a living, people are migrating in large numbers to city, living in very unhygienic environments without basics of sanitation, drinking water, and very dense locations, giving rise to higher rates of tuberculosis, rheumatic heart disease, and the double burden of non-communicable diseases because they end up eating food which is cheap, which is essentially calorie dense and not healthy.
Give us the solution, Shifalika.
Okay, so the solution is develop more cities around. So give more employment, and cities is not only about factories, it's about health systems there, education systems there, and a proper urban planning. It should not be a knee-jerk development of cities, but more cities around need to be there so that people don't need to migrate. And within cities, control the density, have constructions, have set-offs. For example, a study which we have done, it's not yet published, is that people living at high intersections or high crossings, they have averaged their blood pressures higher due to multiple reasons probably. We don't know the reasons, but it's probably air pollution, it's probably the noise, and probably a number of other things. So similarly, people living along highways. So wherever we find densities along highways, the average blood sugar is higher, blood pressure is higher, infectious diseases are higher.
So Amit, coming back to you, I think Shifalika raised a good point that we need more and better planned cities. Earlier when we were speaking in the day, also you raised, Shifalika, you raised the point that after independence, there have been very few new and well-planned cities that have come up. But Amit, isn't the problem that India has very low number of urban planners for the population? Tell us a little bit about how the capacity for urban planning in the country can be institutionally increased. How have other countries done it? And your thoughts on increasing the ability of India to plan its cities better.
Sure. So I think I'll talk about a couple of things here. I think one, we have the last number I found, and I did a quick Google search this morning, There's 5,000 urban planners in India. Yeah. Now that was a number from 2016. Maybe there's 1,000 more cities and towns, 8,000 plus, right? Now you can't have one planner for a city like Bombay, right? You need, I don't know, 50, 100 planners. We're going to add 400 new urban residents by 2050. What that means is we're adding 30 p.m. So 400 million more people and 20 Mumbais, right? So we don't have that capacity. We absolutely don't have that capacity. And the interesting thing is I was working with Aromar Ravi when he was setting up IIHS about 10 years back. And this was the conversation. We don't have enough planners. Now, has that been solved? No. Does that need to be solved? Absolutely. And then you're talking about not only basic planning. I mean, the planners that are coming out, some of them are good, a lot of them may not be, right? And cities is such a complex system that you need a lot of experience, a lot of professionals who need to understand the complexity of the problem of the urban system to be able to make good decisions. And I think that's where we're completely failing all of our Indian diaspora. We are not providing good cities because we are not understanding the complexity of the problem. And I'm saying that with experience. I'm doing a lot of work now with the Smart City Mission in India. We set up a National Urban Resilience Unit at the National Institute of Urban Affairs, essentially to raise the profile of resilience. And tomorrow, the Minister of Housing and Urban Affairs is going to announce a climate assessment framework. So it's going to be literally getting announced tomorrow. But that's only a little, a drop in the bucket. There needs to be a lot more investment in this space. And I don't have an answer yet. How do we do it? Different countries have different numbers. You need certain amount of population. You should have one urban planner for, and maybe Amir, this number, but one urban planner for 100,000 people. We've got 800 million urban residents by 2050. You do the math. We're not nowhere close to that.
But Amit, can I respectfully challenge you on this count?
Please.
Is the emphasis on urban planning as a route to resilience justified when up to 40 to 50% of some of the world's most risky cities are informal and lie beyond the purview of planning mechanisms? I did my research in Gorakhpur, which is on the Indo-Nepal border. That's where I did my PhD many moons ago, almost 15 years ago now. They had a fantastic master plan. It had a fantastic city development plan.
I know where you're going with this, and maybe I'll interrupt you.
The reality is totally different. Over to you.
So it is a failure of urban planning. I mean, informality is a clear failure of urban planning. You go to Dhaka, 75% of the city is outside the formal system. So what are you going to plan, right? But that's failure of urban planning because it has got a lot of other issues embedded in there. There's issues of politics. There's issues of land rights. There's issues of, let's face it, we are not a very equitable society. And we are not, as a power broker, as a person who sits in the powerful position, how many leaders are giving, how many leaders are actually thinking about the bottom half of the city? And if you're not thinking about it, you're not doing anything about it, well, that's a failure of government and planning. Now, there needs to be a lot more effort put in. Slum rehabilitation, and Bombay has tried a few examples. And, I want to give them credit that they've actually tried some examples. They've not really worked. There are examples across the world. The World Bank tries a number of different models of improving slums, but a lot of that takes a deeper understanding of the problem, which often we are not able to put time and money and resources behind.
Right.
I'll stop. Yeah.
Great. No, that's really useful. Amir, coming to you, I think Amit touched on the issue of institutional capacity for enhancing resilience in the country. IIHS, as I said, is one of the foremost institutes focusing on this. And if I'm not mistaken, one of the raison d'etres of IIHS being established was to plug these institutional capacity gaps. So tell us a little bit about IIHS's mission, how it's going about trying to plug these institutional capacity gaps, and give us a tangible example of the impact that research and the work that IIHS has done may have had an impact on a city's resilience, or on a particular policy that may have helped an urban community.
So very quickly, these are like three different questions, but of course, as Amit also mentioned, IHS was set in motion because our director, Aromar, recognized the need that we don't have adequately trained professionals to address urban problems. So that was the core idea. And what we were receiving in terms of city managers and consultants, they were largely trained in specific disciplines. So they were learning by doing, but I think the nature and quantum of challenge was too high and too huge to kind of not think about a cadre that has a very, very integrated and a holistic perspective of what the source of this challenge is, etc. So the idea was that, look, we'll set up a national university which will focus on building this cadre. So we'll get young people, we'll start master's, PhD and bachelor's program, and we titled it a master's, bachelor's, PhD in urban practice. But the core idea of that program was that program is not an economics degree, and that's why we named it as an urban practice. And we said that, look, interdisciplinarity is the core. And to achieve that, you have to have diversity in the class. And you have to go to the field to do two things. You have to first understand the problem in a very interdisciplinary way. And then you have to think about testing solutions that are informed by these different perspectives. And that's how we started looking at, okay, what would be the elements of that kind of an interdisciplinary program. And we understood that, look, there has to be some basic understanding of how we have arrived at where we are. So history plays an important role, the choices that we have made in the past. Then we come to the point that, okay, so there has to be a common foundational understanding of our cities. And so that was one thing. Second was that, okay, then people try to concentrate themselves in certain specific domains, but that needs understanding of other things as well. So we think about concentrations, but those concentrations are not like disciplinary concentrations, but kind of make us understand more about a particular issue. And the category and the categorization of those concentrations are also like very interdisciplinary in a way. For example, inequality. Now, inequality cuts across multiple disciplines. Poverty also cuts across multiple disciplines. So that's how we thought of, we have been thinking about organizing ourselves. And presently we run a 10-month fellowship program. It's a fully taught program. It's on site, and we work with 35 to 40 young people under the age of 30. And it's a class, and you'll appreciate the kind of commitment we have made. It's a class which will have like 3 architects, 2 planners, 3 economists, 4 sociologists, 2 filmmakers, 3 journalists, those kinds of things. And at the end, what we achieve is, we try to achieve 2 things. Are we enhancing our ability to understand what the problem is? Because we can't be thinking about solutions if we don't know what the problem is. And B, are we in a position to think about certain propositions? So we don't kind of push people to start testing those propositions, but at least you have the ability to make certain propositions. And if we bring these two together, our only aim with in this 10-month fellowship right now, and this is going to be an expansive affair when we become a university, is to discover our own urban practice. So we engage with the urban in multiple ways, but we have to find that avenue of engagement. And I think this is where the challenge is. And it has not been an easy journey, but it's been really very meaningful to undertake this journey. And if you have time, I can come back to the last point.
Sure. It's really interesting to hear about the institutional history of IIHS. Now, give us an example of a piece of research that the Institute may have done and the impact that may have had.
Well, it's very difficult to, but of course I can. So I'll make a very simple case here, and that's a very interesting case. We said that, look, if we want to understand what the problem is and start thinking about propositions in line of solutions, we need to have material. We need to have we need to have evidence. We need to have descriptions about what the situation is. So some 5 or 6 years back, we started on this journey and we continue to philosophically kind of imbibe those project ideas. Is that, look, whatever we do and whatever we kind of work on in terms of research or practice, we are going to produce material that is relevant in the context of our operation. We can't be teaching a master's class with a case that is from North America. We need to have a case which is close to our heart. We need to understand the Nasiks, the Gorakhpurs, the Rourkelas of India, and not only Bombays and Mumbais and Delhis and Bangalores of India. So I think that is our commitment. That's our social contract. And we have kept everything open access. And interestingly, our idea, and this is where our philosophy kind of intersects, and this is where the philosophy of capacity building also intersects. As you know, Aditya and others also, teaching and pedagogy has power inbuilt into it. There's power dynamics and power relations in the class, and our only aim is to invert this, make the process of learning joyful and powerless. And so the idea was to create rich material. And I'll give you an example. There is a case available which has videos of someone just going to a public health center and documenting day to day what is happening there in a public health center.
Now, ethnographic study of what happens in a public health center.
So looking at or approaching new, collecting evidence in new innovative ways, in rich ways. So we have to create these rich descriptions. If we are not able to do that, and then we use that as discussion prompts and open things up. And that's one thing.
Really helpful.
And second thing is, I would say that I think there's a lot of work, and you must have followed Gautam's work, etc. And there are others. There's a lot of work in the housing space, etc. I think there's an interesting work that's happening, and that kind of connects to the idea of urban resilience that we are talking about.
I'm going to come back to you, Amir, to recommend a paper in a minute. Sure. But Amit, coming back to you there. So IIHS presents one model of an institutional response to solving the problem of urban risk over the long term. And 100 Resilient Cities, the highly salient program that you were a key member of, presented another model. So tell us a little bit about this really path-breaking initiative. What was the problem that it was trying to solve? How it did that? And what were some of the impacts that it had, and where, if at all, did it fall short?
Sure. So, I think 100 Resilient Cities, some of you may already know about it, was a program supported about 2013 onwards, to 2013 till last year, for about 6 years, where we worked with roughly 100 cities in the world. Yeah. And these included the New Yorks, Sydneys, Malaccas, Surats, so 100 cities literally across Cape Town in Africa, Latin American cities, etc. It was a network that was set up with a certain model of how to look at resilience. This came from theoretical underpinning of resilience. There was a certain framework that came out of, and a lot of this material is available online, so I won't get into it. But there's a certain framework that each city went through a certain process using that framework to understand their underlying stresses. This goes back to the whole discussion on, what are the stresses in the system, recognizing those stresses, and then how do you address them? And for that, we help cities come. So the program itself was 100 cities, or, signed a chief resilience officer. This was a sponsored position. The intention was to break the institutional barrier, which often is a problem in our cities. The transportation engineer is thinking about transportation. The water guy is thinking about water. The housing person is thinking about housing. They're not thinking across. And the intention was that by placing a chief resilience officer in a position, and we've selected these individuals quite carefully for the purpose of informing the decision maker with a much more integrated approach to address the key stresses in the system. Yeah. So the model itself had cities, like peer-to-peer learning between cities. Now, I completely appreciate Amir's point that you won't have an example from New York that works for Chennai, right? But what we did is we actually set up a certain mechanism where multiple cities would come together with experts, with a certain approach to understand what was the problem. So understanding the problem and then finding solutions. So capacity building has been through peer-to-peer learning. The network still continues. I'm still part of that network. It's no longer a fully sponsored program like it used to be. So now it's actually gone over to the cities who've taken ownership of this network. Cities are still committed to it. There's, all of these cities actually have a resilience strategy. So next week, we're in the process of updating our website. So if next week, by the end of next week, if you go and look at resilientcitiesnetwork.org, you'll find 100 strategies online that all these cities have published that essentially documents what they see as their challenges from an urban resilience point of view. What are the measures they want to undertake to address those challenges? Yeah. The program has really been built on peer-to-peer learning. It's like understanding that there are some cities who've addressed challenges of resilience. I'll give you one example. There's a partnership that we've now built with Surat and Rotterdam. Okay, Rotterdam is one of the Dutch cities that does exceptionally well when it comes to water management. Now, they have nothing in, when you look at Surat, when you look at Rotterdam, they're completely different for a variety of reasons. But we've spent about 1.5 to 2 years building a relationship where now the engineering teams are talking to each other. It's like a technical staff conversation. And then, Surat is actually one of the most vulnerable cities when it comes to climate change. Having access to a city that understands how to look at water problems and having access to technical people who can understand and guide, that's been some of the success stories for our. It's not that they have the solution. It's more, how are they looking at the problem? How are they thinking about addressing the problem with experts who've actually done it before? That's been the value of the network.
That's really fascinating. I'm getting a prompt from the organizers. So I need to transition to our exciting rapid fire round in which I will shoot questions at you and give you no more than 20 seconds to answer. And I'm going to put Shifalika on the spot and begin with you. At the beginning of this discussion, I asked you to give me an elevator pitch as to why we should invest in building resilient and healthy cities. So that pitch was successful. I've earmarked $100 million for you. And tell me 3 things that you're going to spend that $100 million on in the next 5 years.
Okay, So first of all, build a very strong healthcare system, a state-provided, strong healthcare system with adequate human resources, quality human resources, which will provide equity and dignity to each and every individual in India. Secondly, of course, is widen the payments. Third is start protecting your green spaces and allocate more space for that. Give options to people. I mean, there's no reason why we should not be able to turn that around, and get health into the planning. So I kind of urge the planners, I urge the architects, I urge other people, the municipalities. I've gone and met the PWD engineers, I've gone and met everybody, that get health into their planning. And the money, healthcare system, white pavements, lush green tree canopies, and green spaces, urban forests, along with a strong healthcare system.
Great.
So,
Amit, what are you going to spend your $100 million on over the next 5 years?
I already gave you the answer in my conversation. Train more planners. Put all of the 100 million into training good urban planners.
Amir, over to you. What are your plans for your 100 million?
Well, I'll take the other route and be a city manager. I'll say put everything and get basic services to people.
Great. So the conversation has touched upon a number of really interesting things, and I'm sure the people who are listening and watching would be keen to know more about these issues. So again, Amir, starting with you, could you tell us one paper, article, or book that has really moved you and informed your view on the things that you've talked about today?
Very difficult, to be very honest, because
and it cannot be one of your papers.
Yeah, and not only me, and Aditya also. Aditya's papers have also influenced my thoughts in many ways. But I would actually take a little detour, and I'll not specify something, but I think as researchers, I've learned more and understood people and societies more by reading literature. And I think as much as we can, if we read literature, we understand people, we understand how societies function. Anything, if you can pick up, which is rooted in cities, which has people in the center, we understand. And the book that really has moved me is Rohinton Mistri's A Fine Balance. It actually tells us what is the reality of inequality and opportunity.
Great recommendation. Wonderful. Shifalika, one book, article, or a piece of writing that has moved you and informed you?
I'll have to think on that. I'll put across some links. I'll have to think on that. But I'd also like to just make one small comment, is that let's all of us start consuming less. Because I think we are consuming much more, and we are going to be leaving a huge debt for the next generation. We need to get disabled-friendly structures in place. We don't have any, our disabled people don't have dignity, neither do our elderly people. So these are the 2 points I'd just like to say, and I put together some.
Great. Amit, you've got a wonderful bookshelf right behind you. Pick one item off that and recommend it to our viewers today.
I won't pick it off there because I looked today and I couldn't find it. But it's actually, one of my favorite books is something called Design with Nature, which was written in the 1960s, which is a fundamental book for landscape architects. It's about urban ecology. It really helps you understand how cities and ecology work.
Right.
So I would go there. And then I think anybody who's interested in global dialogues, do look up the UN's Sustainable Development Goals. There's lots of material there. I think that's a good way just to get familiar with, what does sustainability mean? What do all of these things mean? And how's the global dialogue going on around these issues?
Correct. I'm going to again abuse my moderator's privilege and say that the book that really moved me and informed my worldview was a book called At Risk, which was written in the early 90s, which basically introduced the idea that there's nothing known as a natural disaster. Disasters are a combination of poverty, marginalization, political issues, and when a natural event meets deprivation, that's created by society and by politics, that's when a disaster really happens. Shifalika preempted my final question, which was, recommend one thing that we as ordinary citizens can do to enhance the resilience of the cities that we live in. Shifalika very rightly said that we should consume less. What would be your recommendation, Amit?
It's funny. I keep this in front of me. It's a bunch of stamps that the US government had put out maybe 15 years ago.
Right.
And it's just small behavioral change actions for all of us to do as individuals. Right. So you can plant a tree, you can use a bicycle, you can travel less in a car, and also pay attention to the people who don't have what you have in your city. I mean, I think, all of the people on this audience are from a certain background, certain class. There are a lot of people in our cities who don't have privileges, who don't have access to a lot of things. Help them. I mean, help them in ways which improve their livelihood in their cities. They're citizens as well for the city. Yeah.
Amir, it would be great if you could type the name of the book you recommended, because we're getting some questions on that. And sure. Amir, the last word to you. Does the individual have any agency in affecting resilience? If so, what can she or he do?
I think the first point that I would make, and the most important point, is that we have to develop a sense of empathy. We need to understand that there are people who would be living a certain kind of life, and we should have that imagination and experience of understanding those lives. If we are able to do that, if we can feel that inside us, agency will automatically come. We will find ways to influence a lot of things.
I can't think of a better note to end this discussion on. Given the lively nature of the discussion, questions have been streaming in, and I've been trying to do as good a job as possible of clustering them. So I have 5 clusters of issues that I'm going to put out very quickly. And I'd be very grateful if one of you could please raise your hand and answer them, or there'll be awkward silences on this panel discussion. So or I might actually volunteer one of you. We've had a couple of questions on rural-urban migration. And I know maybe I'll actually put Amir on the spot here, because I know IIHS has done a lot of work on this. How big of a problem is rural-urban migration? Should it be seen as a problem? And if so, what are some of the solutions? What are your thoughts on rural-urban migration?
Well, I think I have worked a lot on climate change related issues, and we find that there's not a very clear-cut idea about or a clear-cut evidence that kind of attributes migration to changes in the climate. Like, there's been mixed evidence, but I'll not go into that territory. But I think we recently finished a very long project in Karnataka, and we surveyed a lot of rural areas. What we are finding is that is a very important thing, that there is an aspirational shift. Young people are not interested in farming because, and the core issue in farming in India is water, and it's not easy to do farming without water. And so because of exposure, because of access to so many things on internet and mobile, there is an aspiration, and rightly so, that has kind of taken root in rural youth. They are not interested in farming anymore. Secondly, I think we have to also think about the production value or output that we are generating from land-based systems. Now, land-based systems are not able to support a lot of people, considering that we are going to grow in terms of population. We are going to probably hit 1.5, 1.6. Land is not sufficient enough to support the kind, the number of people that that we'll have in the country. So this is inevitable. And I think what we have to think about is a very simple thing. And I'll close with this example that there's a lot of debate about, look, cities have their own problems about spaces. We don't have space for building new houses, etc. So think about commuting as an option. So the person still resides. He has an adequate infrastructure to use to come to the city in the morning, which is predictable, reliable, affordable. And then he or she goes back to his place of residence in the evening. So this is something which we see gaining some traction. But of course, there are challenges with respect to infrastructure development. So there are no easy solutions, but I think migration is going to remain an issue. I think the only thing I can distinctly say is that youth are not interested in farming.
Right, got it. Amit, a bunch of questions have popped up on urban governance because a lot of the problems around risk in cities boils down to problems of governance. For example, we all know the manner in which power has been devolved to villages, the same has not happened to urban local bodies. Tell us a little bit about what you see as the most burning questions and problems around urban governance, and what are some of the solutions? Pick your top 2 or 3.
I think it's a really big topic, and I don't want to sound. It does come down to a better understanding of the city. I think governance, it is a power game. I mean, and when you think about cities, especially in the Indian context, there isn't a lot of way to raise revenue, right? I mean, a lot of it is either coming down from the center. You aren't able to raise funds locally, and land is a critical piece of what you control in the city. Yeah, and that has a political implication. I think somebody posted about Deve Gowda up here as well. It's like, I don't have to give you examples, but land in the urban system is incredibly a conflict space, right? And governance, end of the day, is also about controlling land and resources. Now, I'm trying to be careful of how I word this, but the Indian administrator, especially like I've met quite a few now across the country. I'm doing stuff in Hubli, I'm doing stuff in Agartala, I'm doing stuff in Chennai, so I meet a variety of them. A lot of them have the right intention, but the system doesn't necessarily allow them sometimes to make good decisions. Now, that is partly because of lack of good data. I mean, there is a vacuum. When you think about our last census was 2011, imagine the number of people we've added to cities since then. We've also have a lot of growth in the second, third, fourth tier cities. Who would have imagined some of the smaller cities that are mushrooming? And there's no capacity there to understand, again, the problem. There's no data, right? So having good data, trying to have some transparency, and I mean, I won't name the city, but I've gone to the commissioner's office. And if you look at his office, all he has is paper files, paper files. And you wonder how, and these guys want to make good decisions, but you wonder, how are they making good decisions? So, even if the intention is there, sometimes the mechanism is not there to make good decisions, or the data is not there, or the political influence is there. So I don't have an answer. I'm trying to unpackage this issue. It's easy to just say it's a governance problem, but there's lots of things behind this, which, and again, I'm not a researcher. I don't want to get into it.
I mean, I also think like fractured decentralization is another critical problem, right? Where cities may have some kinds of political agency and authority, but not fiscal or financial agency,
right, exactly.
To plan their budgets.
I mean, we gave the power to make decisions, but we didn't give the financial power to actually raise funds.
Right, exactly. Yeah. Shifalika, over to you for this one. Tell us a little bit about issues of gender and urban health. How are women more vulnerable to some of the problems that you've described? And what are some of the problems that are specific, specific problems around gender?
That's right. So you've raised a very extremely pertinent question, and actually a very, very glaring and important question. Women are always the second sex the way it is right now. And their health is poorer. They are bracing all kinds of, so what we have something what is known as social determinants of health. And women by definition have poorer health on all aspects, on all social aspects. So whether it be the money issues, whether it be the healthcare, whether it be dignity, whether it be the food she eats, she'll always eat at the end. So none of the healthy food is left for her. And the decision making is not so much with her, but yet she's supposed to discharge the super mother, the super wife, the super daughter role. So it's also, I think, it's a very deep-seated problem. And of course, things are changing. So we are seeing huge differences happening. But even the way moms bring up their own sons, I think the dignity and the respect which comes, the mutual respect. So women are definitely the huge sufferers. So we are seeing large amounts of anemia. But let me also just give you the health perspective. It's always the woman is not fed, the male is fed. But if you want a healthy male child, you need to feed the women. I mean, even if you have to give them that, if you have to give that dose, because there's enough data where if women are stunted, they give rise to smaller children. And these children, when they grow up, they have smaller lungs, they have smaller brains, they have higher risk of diabetes and cardiovascular diseases. So we need to come down to basics: social determinants, health, education, looking after our women, looking after our girl childs, and a strong healthcare system. Of course, one point I didn't raise, and it's not raised at all, is food systems. So getting sustainable food systems in cities is extremely critical, where healthy, freshly cooked food is available, the carbon credits per vegetable or is not high, and the biodiversity. So now there's a lot of data on the biomechanics. So if you're consuming standard food, it impacts the genes in a negative way. The biodiversity, we have 700 kind of bananas in India. We need that biodiversity for genetic care.
Okay, and the final question, final and most obvious question that the same question I'm going to pose to all three of you is, give us your thoughts on how to prevent another pandemic in cities in India.
Who's going first?
You go first. Give us a couple of quick prescriptions on some rules of thumb that we need to follow to prevent another catastrophe.
Okay, the catastrophes which are happening, like the Ebola, the SARS, and the COVID pandemic right now, are zoonotic viruses. They are viruses meant for animals to be transmitted into animals. And when we are continuously abusing nature by human settlements next to natural reservoirs, deforestation, mining, road building, this ecology gets upset, and these viruses then transmit into humans, and they kind of evolve for human transmission, and that's how it happens.
So ecological conservation and biodiversity would be your solution. Amit?
I think we need to learn from this disaster, like this, what's going on right now. And I'll take an example from Singapore because I'm living there. Singapore faced SARS, 7-8 years ago. And because they faced SARS, they had put in place a certain mechanism of communication, of decision-making, of, you step out of the house and you have to wear a mask. There's no two ways around it, right? So there are certain measures they have put in place that has helped the count to be really low. There is a worker housing issue where there's, and this goes back to the equity issues. But I think learning from this particular pandemic and then thinking about what are the steps you need to take. Now, some may be long-term steps. I think I'll just touch on this, but zoning has its roots actually in public health. Shifalika, I don't know if you know this, but it's the populated, congested cities of the US and Europe from the late, after industrial development, where there was a prevalence of disease, actually has been one of the fundamental bottom lines of coming up with the zoning that we're all talking about, the whole, separation of land uses. One of the factors was public health. Now, do our city systems need to change? Yes. How do they change is a long conversation. Where is the problem? It's not urban density. I think, I had a webinar a couple of weeks ago I'd organized. It's not about urban density. It's the socioeconomic factors that have contributed to the spread of the virus. So I think unpackaging why this virus has spread in a certain way, in certain populations, in certain localities, needs to be understood now, so that when there is another, and it's not, this is not just going to happen once. This is going to happen again couple of times in our lifetimes probably. So we need to be better prepared with a certain kind of system in place, learning from this pandemic.
Right, learning from this pandemic and potentially looking at innovative zoning is your...
zoning is not the answer. I'm just making that historical reference.
As an illustration.
As an illustration that, urban planning has actually, there's also a record of, I'll forget the place, there's a US city which actually, the whole sewer system that we're talking about today was also a result of a pandemic in a US city, which pushed a certain technology around the way now we put our sewer lines. So there is a link to disease and how cities get planned.
And if I'm not mistaken, Central Park, one of the reasons Central Park came up in New York was also after a big infectious outbreak of an infectious disease. Amir, tell us how to prevent the next COVID-19.
Well, I'm not an expert to be commenting on that, but I am worried on two counts. And as Amit also rightly pointed out briefly, so cities are places where all kinds of social fault lines kind of melt. And I think pandemics and severe stresses kind of make those fault lines quite visible. And this is not good news for developing countries. We need to learn to understand, we need to learn that how we can live together in a harmonious way, peacefully, and also bring our energies together to be more productive and kind of spread welfare and generate welfare outcomes that are very equitable. I think that's a very clear message. Right. The only thing which I can think about would be very immediately at an operational level is to think about 74th constitutional amendment, which was about decentralization. Can we kind of break down from the city level to very strong ward level institutional systems that are adequately equipped to address as the first kind of stop to manage, implement, address those kinds of things.
Wonderful. So greater decentralization at the city level is one of your ideas for making cities more resilient. I think we are 2 minutes over time, so I'm going to hurriedly close this discussion and let people get to their dinners for those who are of our audience who are in India. But I think across the extremely rich and enlightening comments made by the three of you, there were three key cross-cutting themes that jumped out to me. One was an emphasis on equity, where a city needs to work for the informal sector as well as those who might be more privileged. We need to emphasize the development of capacity and building the ability and capability of people running cities to deal with risk. And the third thing that cuts across your comments is the importance of taking a systems perspective, looking at hard infrastructure, but nature-based solutions, looking at health, but also looking at environment, and really using the power of different disciplines to solve problems. That is a highly inadequate overview of an extremely rich discussion. And I'd like to thank the Asia Society India Center for convening us and for your valuable time in contributing to this extremely rich discussion.
Thank you very much.
Thank you.
If there's no other housekeeping, then we can close the discussion. Thank you very much.
Thank you very much. Thank you indeed.
Thank you, and thank you for listening, everybody.
Yes, patient listening, all of you. Thank you very much.